As the Global Fund Grant Cycle 7 GC7 on HIV self-testing project implementation kicks off for the next 3 years, over 150 participants from 50 NGOs within the Ghana HIV and AIDS network, GHANET, have been equipped with vital skills to combat the HIV epidemic and achieve the 2030 goals of 95-95-95. Highlighting progress towards these UN global targets, National AIDS Control Program Manager Dr. Ayisi Addo noted Ghana needs to do more in the area of testing, revealing that only 65% of the estimated 334,000 people living with HIV in the country are aware of their status.
As a country, we've agreed to end the epidemic by 2030. And to do that, we must have very low new infections. The deaths at any given point in time must be very, very low. And as we speak, Ghana is recording about 12,000 deaths. As of last year, December, estimated deaths due to HIV, it was 12,400. And estimated new infections were about 17,700. New cases of HIV is occurring in our country, and we need to stem that tide. We need to stop that. The only way we can be able to continue to track these new infections, we know the number of people who are testing, and so the introduction of HIV self-test is very key. We always estimate approximately about 1.2 tests in the country. Last year, we did just about 800, 900,000. And when it comes to the first 95, I said we are at 65. It means that there are quite some 35% of estimated population who should know their status. And we need to continue to do this to be able to achieve our targets.
GHANET President and Acting Chairman of the Global Fund's Country Coordinating Mechanism, Ernest Amoabe Otten, announced that the 2024 self-testing initiative is sponsored by the Global Fund is focused on reaching 75% of men and 25% of women.
For this year's implementation, we are mostly targeting men because we have observed that men, our health-seeking behavior is quite poor. So once we are going to the community, we are mostly targeting men for this particular implementation. We want to test at least about 75% of the time. Men will be our target and 25% women.
He further encouraged the NGOs to act as ambassadors in finding undiagnosed HIV cases at the community level.
The NGOs are expected to go into the various communities and distribute the HIV self-test kits. They will first counsel them and give the test kits to them. And after the test kits are given, we have a national hotline that can be called. If there are some questions or some clarifications that the individual needs, they can always call this line and then they will get the clarification that they need.
Some beneficiary participants share their lessons with the press.
I am going to do my best to make sure that HIV ends wherever it is now. No new cases. Those who have gotten already, we are going to trace them and then put them on drugs.
The NGOs in health have been urged to create more demand for HIV self-testing in their host communities to help government attain the 95-95-95 target. For Joy News, Carlos Caloni, Koforidia.